Hello and welcome to the Concussion Fix podcast, where we lift the veil on concussion recovery and give you the tools to take control of your healing journey. If you're living with persistent concussion symptoms, we see you. We know the frustration, the confusion, and the feeling of being stuck in a world that just doesn't understand. This podcast is here to hopefully change that. Each episode, we dive into real questions from real members of the Concussion Fix program, an online recovery program that has helped over 3,000 people find clarity and relief since we launched in 2020. With an average symptom reduction of nearly 50% within the first 2 to 3 weeks of joining, the Concussion Fix has empowered thousands to reclaim their lives. And if you need a little extra help on your journey, we invite you to check out the Concussion Fix program. In every session, you'll hear from our expert team. Myself, Dr. Cameron Marshall, founder of Complete Concussions and a leading concussion researcher with over a dozen peer-reviewed publications. You'll also hear from Dr. Paul Hrkal, a naturopathic doctor specializing in concussion recovery, chronic pain, and neuroinflammatory conditions. And you'll also hear from Melinda Krynen Hill, a psychotherapist focused on mindfulness, chronic pain, and concussion care. These episodes are recordings from our live interactive Q&A sessions with real Concussion Fix members, where no question is too small and every story matters. To protect the privacy of participants, all names and personal details have been kept confidential. Now, before we dive in, please remember that the information shared in this podcast is for educational purposes only. It's not intended to replace personalized medical advice. We encourage you to consult with your healthcare provider for guidance specific to your case. So, whether you're looking for answers, hope, or just a little encouragement, we're here for you. You are not alone. Recovery is possible, and it starts right here.
I saw a few healthcare providers, and so I just wanted to give some updates and get your insight. Um, so I saw my family doctor, like, I've still been dealing with, like, this emptiness in my stomach, and I saw my doctor, and we tested for H. pylori, and it came back negative.
Okay.
And we tested my morning cortisol, which she said came back normal. Um, Apparently it was 335, which I think is pretty mid-range. Um,
It is, yes, it's kind of in the middle of the range. And it was done in the morning on when you were kind of as close as possible to waking up?
yeah, I mean, I usually wake at like 9:30, and I went at like 10:15 because I wanted to wake up at the same time and then have drive time. So I don't know if that's an okay time still.
Yeah, it is.
Mhm,
Generally speaking, the later you go in the morning,
mhm,
then you're going to have a decrease in cortisol because
mhm,
you're looking for that initial spike of cortisol. But as long
mhm,
as you're kind of going in the morning, we can kind of guesstimate. It's really the most accurate way of testing uh, is AM cortisol, which is kind of on waking, but it's hard to do that. And also, you're kind of like getting up and getting ready, and it's always a bit of an ordeal to get out and get to the lab and get
mhm,
your hand or arm poked.
mhm,
So that's why I personally don't love the blood testing because it doesn't really give an accurate result of what your cortisol level will be because it's kind of an artificially stimulated environment. It's also just one point. But like I shared last time, it is one way of just kind of getting an approximation of what your overall adrenal output is. So it sounds
mhm,
like you're not in what would be kind of determined a very, very low state that is in relation to a disease called Addison's disease. And I think when we're looking at saliva cortisol, we're looking at urinary metabolites of cortisol. Now we're looking for kind of shades of gray of a little bit more detailed and nuanced. And you can see those 4 different points that are collected on the saliva and or the urinary metabolite test.
Yeah, and I tried to make it my morning be, like, not stressful and, like, a regular morning for me, and, like, comparing it to when, we tested my morning cortisol when you had sent, like, the request for my doctor, like, 3 years ago.
Mhm.
Remember, it was 660 for my morning blood work. So I think, like, I don't know if it's, like, safe to assume, like, "Hey, maybe I don't have adrenal fatigue anymore," or at least there's progress.
Yep, having a higher cortisol means that you have a little bit more hypercortisol production. That generally is related to the opposite of what would be kind of loosely called adrenal fatigue. I've said before, I don't love that term because for most people, uh, true adrenal fatigue, first of all, doesn't describe exactly what's going on. There's a more complicated system that's happening. But Addison's disease, which is the adrenal failure, which is you're not able to actually produce enough for basic function. And this is the number one reason why family doctors and endocrinologists really don't see eye to eye when it comes to uh, the conversation around the HPA axis or the adrenal system compared to functional medicine doctors and naturopathic doctors, because they're looking at it very black and white. They're not looking at it like, okay, so a person could still have adequate or okay adrenal production in the morning at the lab, but overall their adrenal system throughout the whole day, if you add it all up, is not producing enough metabolites of cortisol in general, or in total I should say. And that's, I think, what we identified before.
Yeah. Yeah, I know, I remember you said, like, that I had inappropriately high levels of cortisol in the morning, but that doesn't seem to be the case now, so, like, those
Yeah,
things
so
were.
that's an improvement, it looks
Yeah,
like.
and so, what's leading me, so I also spoke to a psychologist,
Yeah.
and we didn't do a formal assessment for depression, but I've seen her multiple times, and we talked about depression, and I requested a formal, assessment, and she said, "Okay, well, like, let's just talk about it today," and she said, "Just based off of just talking with you, it doesn't sound like depression is actually a big factor for you. Like, it plays a role and, like, it's on the spectrum, and you might be subclinically depressed, but it's not, like, this leading factor, and that obviously it's not necessarily in her scope to diagnose, like, stomach problems, but in their experience, when a client is depressed or having mental health struggles and they're undereating for that reason for a long period of time or even overeating, which is what I was doing. I've been undereating for quite some time,
Mhm.
actually. The, hunger and, full cues sort of become disrupted when you go back to eating normally after having undereaten for so long. And so that's what she said, and I think, like, that kinda, like, makes the most sense, especially based off of the fact that, like, I've done these other testing.
Yep.
I know that I have been undereating for, I mean, honestly, probably close to a year at this point. Um, and finally going like, "Okay, I'm gonna start eating normally now," even though the appetite's still not really there. And now that I'm eating, like, a normal amount, increasing my carbs to, like, get a normal amount of food in me, um those hunger cues are just not working. And so, I guess my questions are, if that's the case, which I want your opinion on, I feel like it probably is because I can't think of anything else.
Mhm.
h- how does that even work? Like, why? And also, what to do, what the approach is to go about getting these signals back in regulation, because I right now I'm just been trying to eat very balanced and put everything in front of me and sort of guess, "Okay, this is how much I should be eating to feel full." And then I also started taking a probiotic, which I actually feel like might be helping, uh,
Mhm.
because it fluctuates. It's not like an empty feeling constantly,
Mhm.
and I feel like it was getting a little bit better at one point, and then I was like, "Oh, maybe I'll just stop taking the probiotic, see what happens." And again, I mean, not again, I didn't say this, but like correlation does not equal causation, so it could be just a
Right.
coincidence, but it did get a little bit worse, and I was like, "Oh, maybe I should start taking it again." I bought more probiotic, and it eventually started to feel a little bit better, but now I'm taking the probiotic regularly. It's still an issue. So yeah.
Yeah, it's going to take a while to help your nervous system, especially those appetite centers in your brain that are regulated by some hormones. For example, ghrelin and leptin. So ghrelin's that feeling of like I'm hungry. That's what its job is. Where leptin is the feeling I'm full. And
Mhm.
so if over years we've overridden that for a whole bunch of other reasons due to, for example, something as simple as I'm symptomatic, I'm tired.
Yeah. Yeah. Oh, I was just gonna say, like, that was a big thing too, like, I guess I should make it clear, it's not that I was, like, so depressed that I couldn't eat, that was absolutely a role, and that may have played a leading factor for a
Yeah.
brief period, like, a brief period, but a lot of it was really struggling to meal prep on my own when I
Yeah.
yeah.
So for whatever the reason is, it doesn't really matter as much as the reason. It,
Mhm.
it really matters that those signals, just like any hormonal signal, can become disrupted and it needs to be kind of retrained. In the same way that the autonomic nervous system needs to be retrained, I think that this is an opportunity for you to be mindful. And so I think the signals are slowly going to come back online now that you're through that mental health challenge. It looks like the adrenal system is on the mend. It's getting a little bit better. I think definitely the reduction of that morning cortisol does indicate that possibly. And then there are some things like probiotics, and there's even some foods that can be helpful at restarting these kind of endocrine pathways. For example, traditionally, bitter herbs, so foods that have bitter principles in them, like something like radicchio or arugula, these are vegetables that have a bit more of a bitter flavor to it. They can be helpful at stimulating ghrelin production. There are
Mm.
even herbal things like if you go to any traditional kind of culture, they almost all have some sort of preparatory aperitif drink, and these are made of bitter principal herbs primarily. The most well-known one is Jägermeister, which is available in most alcoholic stores that sell alcoholic beverages, but it also is full of sugar, so that's not something that would be a good idea. But the point is that there are there are tools in the botanical medicine world that can help us re-stimulate those hunger cues. And so if our body's forgotten to how to stimulate them or is not stimulating them at the right time, one way that we can do is probiotics have been shown to help this. And just as a bit of a digression, there's now research being done on probiotics to help stimulate this GLP-1, which is what the whole Ozempic craze is all about, and really trying to upregulate this. And this is that feeling of I'm full. And so on the flip side, herbs can do the opposite as well. So probiotics, herbs that have a bitter principles, foods that have bitter principles, and also a little bit of a technique is sometimes the sour flavor or the bitter flavor if consumed before a meal. We haven't really done much talk about the timing of meals, but sometimes that can be a really important thing. So, consuming a salad with a vinaigrette before eating your main meal is a way that it can prime the body to have a more regulated blood sugar response and also prime some of these positive hormones that stimulate, hey, I'm ready to eat, I'm ready to consume food. So that's just one little dietary tip that you can just make sure that you're always ordering the way that you're consuming those foods in the ideal way.
Okay. Um, and this is all recorded so I can re-listen to all that, right?
Yeah.
Okay, great. I tried to write what I could down. And you mentioned timing of meals. Is it really important to continue sort of that adrenal protocol of like eating before, like eating upon like waking and like those like those times of days and eating something before bed, or like I follow it like I don't follow it to a T. I follow it in combination with also like how my concussion symptoms are feeling. Is that okay?
I think in your case, it sounds like you do need to train almost your endocrine system to be regular. You be regular, and on the adrenal front, you want to also train the body to be confident that you're going to be giving the nutrients at the same time all the time. So that
Mhm.
means, you know, on waking or close to waking, you're having your first meal of the day. Then you're having your second meal sometime midday on the earlier side, not waiting until 1 or 2. It's in when a person's really trying to help their endocrine and adrenal system really have optimal fueling, you don't want to have periods of fasting for very long. And this is a confusing part because generally fasting has a beneficial effect on a lot of things like inflammation. But in the one caveat case, in the case of adrenal dysfunction, where people will already know if I don't eat or if I skip a meal, all my symptoms that I'm dealing with actually get a lot worse, and I may even get more symptoms like dizziness, lightheadedness. You might get feelings of anxiety. You might get feelings of what we would consider hypoglycemia or low blood sugar. That could be irritability, just a general aggravation of symptoms. That's a key sign that we shouldn't be skipping meals. So I suggest regular, consistent feeding
Mhm.
in terms of timing.
Okay, perfect. And then last quick question about plantains. Can I eat plantains as a source of carbohydrates, or is that something that should be avoided? Because in the adrenal fatigue handout that you had given me, it says to avoid bananas.
Uh, Plantains are similar to a banana. It does, again, like a banana, it is pretty starchy. It's going to be converted into sugar pretty quickly.
Mm,
But I think in your case, we're not against having vegetables that have some sort of carbohydrate. I think that there's a role to play for those types of foods. It's more so if they're the main source of calories, like a lot of people, like I had a patient yesterday that there was a huge component of just eating pasta with dinner or rice with dinner and then a little bit of sides. That needs the shift. So we're trying to make that a complement. So to answer your question, plantains are fine. Just make them a really small add-on, maybe a snack, or even better, add on with some sort of protein. So you're going to get a slower glycemic absorption here.
yeah, and like bananas, grapes, grapefruits, those things that are listed should still be avoided, like it says in the thing.
Those are just higher sugar foods or higher sugar fruits.
Mm,
Something to be mindful of not overdoing. We're trying to have almost like a 2-to-1 ratio of vegetables to fruits, but fruits
mhm.
still are a really great source of antioxidants and flavonoids and these really beneficial anti-inflammatory molecules. So those are okay in moderation.
Okay. Okay, thank you so much.
All right.
Okay, hi, how's it going? Good morning.
Good morning.
Um, so I have two questions. One, I wrote them down so I would be a little more concise, maybe. I'm just gonna read it. So last time I mentioned 2 years ago, I had a concussion in February. The CT scans after were normal, and there was no pineal cyst. After the acute phase, I didn't have any PCS symptoms. In October, I had the craniosacral treatment. And imaging after the treatment showed a pineal cyst. Since that treatment, I've had extreme hormonal imbalances. And after a year of working with a naturopathic doctor to balance my hormones, I'm still on a roller coaster. How can a pineal cyst affect hormone function and emotional dysregulation?
Good question. So just to be clear here, you had the pineal cyst was discovered in October of 2023.
Yes.
Okay, so that's been over a year.
Confirmed that there was no pineal cyst on the February 2023 imaging.
Okay, I'm just making sure I have that straight. Okay, and then what was the treatment that you had before?
The craniosacral treatment where they palpate the um I guess like the fluid around your brain, and that's when and I even had to sign something saying in the forms beforehand, it said if you have had a concussion, don't do this treatment. But it had been 8 months prior. I didn't have any symptoms. I was like, oh, I haven't recently had a concussion. This is not still a problem for me. And so I had the treatment, and I was nervous about it, and I asked them beforehand, and they actually didn't write back until I got there, and so I was already there, and they were like, yeah, like it should be fine. Um, but then I was completely not fine at all since that point afterwards.
When was the craniosacral? It was in October?
October 2023.
It was just one treatment?
One treatment. But literally that from that moment forward and still until now.
So was it all previous symptoms that started?
No, I didn't have PCS symptoms from February to October.
Right. No, I understand that. But are these symptoms are ones that you had from that previous concussion at some point? I know that you don't.
Yeah, for the acute symptoms, like no, but there were new ones. So acute symptoms like I drove home and it was at night and all the beams of light. I was extremely sensitive to light. I was extremely hungry afterwards, extremely cold. The extreme sensitivity to noise, all of those things that I felt like I had a concussion again. Uh, and then the new symptoms were extreme hormonal dysregulation. So I started getting morning nausea. I started like dry heaving in the mornings at certain points on my period. Like we thought I was pregnant. I went to the ER. Like they were like, "What is happening to your body?" Um, and those things would cycle every time after that craniosacral treatment. Those symptoms would cycle every month at certain times during my period.
So it would get worse around your period.
Yes, at certain points in my cycle.
Okay. And then how did they find the cyst? Was it like imaging done right away?
They were doing imaging because they were just trying to figure out what was wrong. Nobody thought it had anything to do with a concussion because I hadn't hit my head again.
Right.
And so everybody was just doing imaging because I wasn't functioning at all. And they were trying to figure out what was wrong. And that's when they found the cyst. And they were like, oh, yeah, this probably doesn't mean anything. It's inconsequential. But that's when I called the imaging from before. And I was like, hey, was this present in February? And they confirmed that it wasn't. So
this is an MRI that was done?
I believe it was
or CT scan?
I believe it was a CT.
Have you had an MRI?
I believe I can't remember. I believe I've had both. I believe that maybe the first one was an MRI and the second was a CT, but I would have to confirm. I don't remember exactly.
Okay. Obviously, first of all, I want to just make sure that everyone understands, there's a lot of very personal information here, and we're not giving you a treatment recommendation, where you're just sharing your symptoms freely. Now, I mean, none of us are experts in craniosacral. So I don't think we can comment on what exactly was done. And what I know of osteopathic medicine and craniosacral, I'm kind of lumping the two because they usually kind of work on the same type of like very subtle type of movements. I've seen osteopaths do some similar treatments. It may have shifted some CNS around, or it may not. It might have been something. This might sound a little hokey, but it might be actually something totally energetic, because there is an energetic nature to our bodies as well. But that is an area that is well above it's just very unknown, and it's incredibly unpredictable. So
So as far as the hormone function and the cyst presenting after this, can cysts affect the regulation of hormones?
The hormones that you described, the pineal gland doesn't really have a huge role to play. The pineal gland primarily is responsible for the circadian pattern and the production of melatonin particularly. But it's really the pituitary gland and the hypothalamus that really is regulating hormones. So at this point, I don't see a strong connection there. That's why I'm saying it's really atypical.
Yeah,
So
I mean, my sleep also did get really bad.
Yeah,
But
I'm
uh,
thinking just to like zoom out, like big picture, right? There's this concussion 8 months prior to the treatment. There's mold exposure. There's COVID, then this treatment.
yeah,
So if you're looking at this big picture, there is a number of big stressors on the body. So
there's two more too. There's two more
and there's
stressors.
more. Okay, right? These are all huge stressors. So I'm thinking it's
yeah,
less about the treatment.
Yeah.
That might have been that tipping
It's just
point,
that
right?
that was like
That was the tipping point.
the
That was
line of deep. It was like the line in the
yeah,
sand of really, really being full functioning before that and being extremely full
yeah,
functioning after that. Or
absolutely.
no, sorry, extremely not functioning
Not
after.
functioning. And we've heard this before. Yeah, we have had members with the same types of stories where this one small trigger seemed to be the tipping point, which made no sense. And it can be really dysregulating to think about a small trigger as becoming this huge event. Of course, we can't diagnose and we're not able to look into this further to say, hey, this specific thing that happened in your osteopathic treatment is the reason all of this happened. But in our area of expertise, zooming back on this full picture, there were a number of significant stressors leading up to this point. So I
Sure.
think, in my expertise, all I'm able to say is maybe less emphasis on that treatment and more emphasis on the big picture of what led to that experience, because a lot of things cascaded and created a lot of turmoil for you. And I think the big
yeah,
picture might be more helpful than just that one specific treatment, since we explored it quite a bit today, and there wasn't anything physiological that happened in that moment that sounded really
yeah, exactly.
damaging, right?
I guess that leads into my next question, which I'll make quick. Is that one of the patterns that I see when I implement? Like I've been extremely religious about how I've been going about getting well. Um, and one of the patterns I see is that when I implement something new, I see a massive improvement. When I started supplements like multi-mineral, I looked like I reverse aged. My skin looked amazing. I had so much joy and energy. And then I was like, I'm well. And then it kind of tapered off. When I started implementing the exercising every day, I had really great mood, this great energy. This lasted for like 2 months. And I'm like, I'm well. Then, same thing. About 2 months ago, I cut out all the sugar, processed foods, gluten, dairy. 2 months, I was like, my hormones are balanced. This is amazing. And then now they're not again. But I'm still doing all of those things. So it's like I'm being really consistent as far as taking the supplements, doing the exercising, eating 100% clean. And it's frustrating because it'll be really great at the beginning and I'll think, "Oh, this was the missing piece." And then it will just kind of slide
Yeah,
back again.
yeah,
So
and I think
that's
that
why I was
that leads.
asking if there was something more underlying rather than like these foundational core things.
One of the simplest things that just comes to mind, just really quickly, because we're over time here.
Yeah.
The Just test these things. So, like, if you have a question about hormones, and this is where you can kind of go
Yeah,
back to
yeah,
your
that's already
doctors,
been ordered. Yeah, that's
right?
been ordered.
Exactly. So, if you're waiting on that, like, if you're like, oh, my hormones off, if they're actually off, then you'll find issues on labs and blood work and additional testing that will prove that it's off. And then, to Melinda's point, you can start looking at piecing together that environment and the kind of the situation that led to that, the multifactorial situation that led to this straw that broke the camel's back, so to speak, with this particular treatment. So collect that data, and that will prove to you to say, hey, this is what's going on. It's sometimes pretty common where patients will get better initially, where those things are all good, but they're not the root cause. Supplements are helpful,
Yeah, that's what I'm trying. I know
but
that
not the
they're
root
off.
cause. Yeah,
Yeah,
so
yeah. I
that
know that they're off.
happens.
I'm just trying to find the root cause.
Yeah. So message
Yeah.
me on the forum and we can continue the conversation offline, just for
Okay,
the
great.
sake of time here. I do have a
Thanks.
couple other thoughts if you want to, because I really, we all
Okay,
kind of
great.
feel for this situation. We want obviously to see you get better, but we can pick this back up in future lives or
Okay,
offline.
thank
Okay.
you. Thanks again.
Can I just chime in? I know you're trying to wrap here, but I just want to kind of go back on the thread that Melinda was pulling on of just terms of There's multiple causes, right? Like you said, oh, it has to be the concussion then because the symptoms are similar to concussion. The symptoms of concussion and PCS are non-specific, meaning that they're not just concussion. That the reason why the treatment for concussion is we don't treat the concussion, we treat all the other potential causes of those same symptoms, right? Like when we're treating people with PCS, we're not treating their brain. We're reducing inflammation. We're balancing the autonomics because dysregulation in those systems is what causes those same symptoms. So you have a number of stressors that lead up to this. COVID can cause the same symptoms as concussion, right? And the treatment is essentially balancing autonomics, reducing inflammation, getting good sleep, all these other things. So although the timing of this treatment tends to overlap with what your experience is, there could also be a factor where if you have this experience, you're starting to feel symptoms, well, then you start to kind of spiral. It adds more stress to an already stressed situation where you start thinking, oh shit, why am I feeling like this? Did this bring this back? And now all of a sudden you spiral kind of out of control. And then now you have anxiety that flares up. That starts affecting sleep. That starts affecting hormones. You know, the added stress can start to do that. Now, concussion by itself can cause hormone dysregulation. We have all sorts of evidence that concussion by itself starts to cause pituitary dysfunction in some people, but it takes 8 to 12 months before that
Right,
starts
right. I'm
showing
reading
up.
about that now.
So the
Mhm.
timing of this could just be the sense that you're dealing with the hormonal fluctuations that happened as a result of the concussion, but they've come on because of the other stressful events that happened that just eventually led to this, right? If you think back to like the concussion cliff analogy, it's like you may have felt good, but you were standing right on the edge of the cliff. And then a number of stressors came along, which actually pushed you off the edge. So you're saying, oh, this must be concussion. No, it's not. It's dysregulation in these systems. It could be just a lot of anxiety and stress in your life that's affecting all these things because that's going to influence your hormones. That's going to cause inflammation. That's going to cause gut issues. That's going to cause all these other things. So it may have something to do with the cyst. However, the cyst would likely be more related to just sleep dysregulation and melatonin just because of the location of it. But most of the time, these cysts are actually asymptomatic. Like people don't,
Yeah,
they don't cause
totally
any
may
issues,
have
right? So
nothing to do with anything.
the majority of the time, they're completely asymptomatic. So this might be just a red herring that you're really focusing on. And that's potentially driving more stress to be like, oh, this treatment caused this cyst or something along those lines. And that's just adding more stress to the system, which is causing further dysregulation. So that's why I think we just need to take a step back. Think about this of like, okay, these are the symptoms. These are the potential drivers of those symptoms. Hormones may be one. You're getting it checked. Great. But at the same time, it's like just continue with the plan. Try not to be so stressed about if I add something, I feel great. And then I start to kind of, go downhill again. Um, Try not to be so, rigid on it and just try to be more, I guess, kind of relaxed in the approach in a way, because if you have that like diligence and I have to do this and I have to do this, that's just another stressor.
Right, and
Um,
I think I just wanna capitalize on it because it's so important, and I think it's so important for our audience as well, is looking for a why, right? We always look for a why. Tell me the one thing that caused this downward spiral, because then I can focus on that and get back to my life. But sometimes if we hyperfixate on the why, it actually just spirals us so much further down. So I'm really hearing that throughout this whole conversation is there's got to be a reason, right? It's got to be the osteopath, or it's got to be the hormones, it's got to be this. Of course, we're doing that, right? And every single one of us here, including ourselves in our own experience with health, are we're going to look for this why. But sometimes it actually complicates our healing and recovery and leads to more suffering, right? That brings us to that pain times resistance equals suffering.
Mhm.
We've got this pain, something happened. We're resisting it. Not that we're saying, hey, this isn't happening, but we're resisting it because we're just trying to figure out why. And that's the only thing we're focused on. And what ends up happening is we suffer more. That's a huge added stress when we're just focusing on the medical reasons for what happened. It makes sense to do that. What I always say to my clients is let's do that in moderation, right? You have to live
Yeah,
in between.
I let go of that
Yeah.
why. I think I'm only circling back to the why now be after I'm implementing all these things, and
Yeah.
then I'm still not well. So that's why I've circled back to the why, because like I did the mindfulness modules and all this stuff. And I was like, you
Yeah.
know what? I just need to let this go. It's not serving me. It's not helping me. But then when like the exercise plus the supplements plus all this stuff plus the sleep stuff isn't making me well, I'm circling back to the why to figure out like, okay, Why has it been so long of me being really consistent and still not being well?
And that's part of this grieving process. We talked about this in Alive, right? We go into this mode of let's fix it, right? Then we lean back into, okay, let's let it go, right? Let's be compassionate. Let's like slow things down. Then we can go back into a grieving cycle of no, I need to fix it, right? And all of that is normal. I really am just pleased, and it's so helpful that you shared this with us because it touches on such an important topic of the journey through some of these really complex symptoms. None of them are your fault. Nothing that you
Right.
did caused this for yourself, but it feels so out of control that we do everything we can to try to regain control. And then sometimes when we hold on to that too much, it actually creates more symptoms because stress in the body creates more tension, increases our symptom flares. So it's this whole conglomerate of, complex health issues that's happening for you right now. And none of it is wrong, right? You're doing everything you can to support yourself. I think I just want to extend that invitation of see if you can go with the motions of it, right? I sometimes work with clients and I say, pick 1 week of the month where you focus on the why and work on your health and have all your appointments. Then another week of the month, you don't do any of that because what you need to do is just get out and walk or live your life or see a friend or work or whatever it is. Then 2 weeks later, you might take another week where you focus on the why, right? So it's finding a balance because if we're constantly in this mode of let's fix, I mean, and that's why you're here, right? Is to ask these questions and to try to figure out the why. But just to bring this awareness around, how much this can create weight for us in our recovery from anything complex, not just concussion. But again, this is very much what our members experience with PCS.
So you're saying don't for the whole 4 weeks, don't focus on the like exercising every day and eating no sugar and all that stuff. Like, don't
I
always do that.
I think the guidance or the routine that you're in, yes, like if walking every day is recommended by Dr. Kim and working on the diet is recommended by Dr. Paul. What I mean is keeping our mindset in a place of I don't have to over focus on this stuff. I can carry on with the routine I have and let go of the rest. And 2 weeks later, maybe I pick up one more thing, but finding a balance for yourself so that we're not in this state of hypervigilance of what do I add next? How do I figure this out? Why did this happen? What do I, how could I have done this in the past?
Yeah. The other thing, just one more final thought before we move on, because we do have to move on. But the other thing to consider too is like when you start doing something, like you mentioned, exercise, you were doing it feeling great. What starts to happen is when we start feeling great, we end up, we generally start to do more, and then that can cause kind of some of that setback too. So just kind of keep that in mind of not, even though you're feeling good, don't try to go out and do a whole bunch of things because then that could set things back as well because it just creates more kind of stress on the system. So you want to just do things in a very gradual, orderly way and just kind of be mindful of that. I'm not saying you did that, but I'm just saying that can happen as well. So just keep that in mind of as you progress. I mean, you're doing the things, get the hormones looked at, see if there's anything there. If there's nothing there, great. Then you can cross it off your list and say, okay, what else could be contributing to this? And oftentimes, if you've gone through and done things and had a lot of benefit, and then now you're starting to plateau, we always recommend just go back to the start and start over again because you're going to pick up more things. You're going to have that potentially added benefit of things being like, oh, I've gotten out of that part of the routine. I'm going to start maybe implementing that again or whatever. Um, but give yourself a break. I'm sure you've come very far, and just slow and steady wins this race. Okay, slow and steady.
Yeah, we're all sending you some compassion and warm thoughts. And thank you for sharing this with us. I think it's so important for everybody here today because, a lot of the members are in the same boat and a lot of the listeners are in the same boat. I'm seeing a ton of comments in the chat too, sort of validating that.
Great. Let's move on to.
Good morning. I wanted to thank you all first for the Concussion Fix program. Really appreciate it and all of your efforts. I have two main questions today. I have had two concussions in a year and a half. And one of the most impacted things for me has been my eyesight, my visual field. Um, so And I think I didn't realize how far off it was. I moved to Europe for half a year last year. and my eyes just couldn't track all the motion of being in like public transportation. And I started to get way more head pain. I already had prisms in my glasses pre-concussion. And so one of the things I got excited about in the Concussion Fix program is when Dr. Marshall was saying, if someone's trying to put you in a really long vision therapy plan, that may not be always the right thing, because obviously we're working with neck dysfunction and, the vestibular field, et cetera. So I guess my question is this. I think that I already had some pretty significant vision issues even before I got concussed, and then they were majorly exacerbated in both incidents. And so now I've just come back to vision therapy in the States, and it seems like it's going to be a long program, but I do also feel like, because I'm wildly tired, and then I have a lot of head pain that seems to be related to the vision. So how do I know what's what with the treatment plan, how long to keep going, when to look at other things? Wait, one last thing I want to say is I've been to like a concussion recovery clinic where we've done full-blown diagnostics, and the way that you described, putting together in the right way, shape, and form, kind of the order of things. So I think this is where I don't know where to go next.
Yeah, so I mean, you had vision issues pre-concussion. Typically, concussion will exacerbate your weak spots, right? So if you're really inflamed and you have a poor diet and your gut health isn't great, concussion's going to exacerbate that because that's your weak spot. If you have pre-existing anxiety and depression is going to be your weak spot, and that's going to be the area that's going to exacerbate all your symptoms. So this could be that you had pre-existing vision dysfunction, and concussion's just going to exacerbate that, and it's going to key on that. The other thing to consider, because vision is so tightly related to neck function, is that you also could have had pre-existing neck dysfunction that was contributing to your vision, and now concussion is going to cause more neck dysfunction, and that's going to contribute further to your symptoms. So it could be a combination of both. You could have neck issues that are contributing to the vision, and you could also have some vision problems. Now, what I always recommend that is, if you're going to do vision therapy, make sure you're also doing neck simultaneously, because the two are going to be additive. If you're on a budget and you're saying I can only pick one of these, then I would start with neck, because if you don't have good neck function doing vision therapy, you're going to hit roadblocks where the vision therapy is not working. And it's not because the vision therapy is not important. It's just because your neck can't function. Now, the way you describe it, that when you do the vision therapy, your headaches get worse. Well, to me, that signals neck, because with eye movement, your neck muscles are engaging. Every time you move your eyes, your neck muscles are engaging in preparation to turn your head in the same direction that your eyes move. So when I turn my eyes to the right, every muscle that's designed to turn my head right engages. Now, if I'm doing these eye exercises, those muscles are constantly engaging. If they're dysfunctional, that starts to cause referred pain up into my head. So you feel it as a headache, head pressure, head pain. It's actually coming mostly from the neck. And you're going to say, well, it's my vision, because every time I do vision, then it's my headaches. But it's actually this kind of full circle where the eyes move, the neck engages, the neck is what drives the headaches.
Yeah, yeah, I get that. So I see a chiropractor like once a week, and
Is he just doing adjustments on you though?
mainly adjustments. Yeah.
Not the right thing.
Okay.
Adjustments won't do anything for this. It's soft tissue work. And a lot of times people ignore things like deep neck flexors. They don't treat the front of the neck. They'll push on the suboccipitals and that'll be it. That's not what you're looking for. I did a 2-part series. It's in the resources. It's manual therapy part 1, manual therapy part 2. I break down all of these kind of relationships and show you like what you're looking for, and then I have example videos of me like treating somebody to see like, oh, this is the type of treatment I should be getting. Just because you're going to a chiro doesn't mean that they're treating the right thing or the right way, right? So you have to find somebody who's actually going to treat those things, and I tell you exactly kind of what things to look for. And then I would try to find that in addition to vision therapy. Because otherwise vision therapy is probably just going to flare your symptoms up if you have a neck issue, and it's just going to cause increased head pain, and it's not going to be effective, and you're going to just spin in circles and spend a whole bunch of money and get nowhere. So you need to have that neck. Like, I mean, one of the examples I always use is our vision therapist. When I first met her, her treatment plan for PCS was a year long. And I was like, that's crazy. And then so I started talking to her about the connection between eyes and neck. And then she started referring all patients to me before she would see them. Her treatment plan now for PCS is less than 3 months long. And now it's kind of standard to say, go get your neck worked, right? So a lot of vision therapists don't know that even, right? Like I gave a talk in Dallas a few years ago at like a vision therapy conference about the influence of the neck on eye function. And I showed them all this research, and it was just like gaping mouths looking at me like, what? Like they had no idea.
Yeah.
So a lot of people don't know this. And so I would just try to incorporate both.
I think that's great. And the concussion recovery clinic I went to actually has me doing neck exercises, and the
Exercises won't
NMT.
work. It's
Okay.
not exercises for this. Unfortunately,
Okay.
it's manual therapy. It's really good manual therapy. Exercises won't really
Got
do
it.
anything because if you have muscles that are stuck to other muscles and they're tense on one side, ultimately it's like you can do these types of exercises, but you're going to have an altered movement pattern, right? Like if I have a shoulder injury and I try to lift my shoulder, I'm going to do all these weird contorting things to be able to do the movement. Your body's very good at changing the movement pattern to get around dysfunction. And so you're doing the exercises, but all I'm doing is reinforcing a bad movement pattern. Whereas if I got in there and actually worked on some of those tissues and had good joints, but now I can actually do the motion properly. So the way to do it is manual therapy, clear up the dysfunctions, then you can start doing the exercises and strengthen to keep it where it's at. But if you're strengthening before those dysfunctions are cleared out, all you're doing is reinforcing those dysfunctions.
Great. And is ART considered manual therapy, or is that
Yes.
also different?
No,
Okay.
ART is what I do. That's the one I recommend. So in that thing, I generally recommend finding somebody who is ART certified. Um, Bonus if they're a chiro, because then they can also adjust the joints. And then also if you go to their website, right, do a little bit of research on them. And if one of the primary things they treat is like headache disorders, they're probably pretty good at treating necks because that's why they're treating headaches, right? They're treating headaches because they're neck related headaches.
Okay, awesome. My second question is just about hyperbaric oxygen. I know that, in the concussion fix, the other clinic that I went to, it's actually not recommended because it seems like it's more of I've heard that it is more of like a placebo effect.
Mm-hmm.
And recently I've had 5 different people from my primary care to all kinds of people recommend it. And I'm just curious if you could speak further to that. I've also, I just want to say one last thing. I've also had COVID several times. So brain fog, cognitive, that's a bit of a thing for me. And at the clinic I went to, I used something called the carbohaler, and that was actually really helpful. That felt helpful. But hyperbaric, I literally, people say to me all the time, oh, I had a friend who healed from hyperbaric. I had a friend who's done that. So I'm open to why it's not not sort of in the mix.
So, I mean, this is a contentious issue because, like, I talk about it in our training course, and I have people that are in our training course who are medical professionals and whatever that'll be like, I think you're wrong on hyperbaric, and here's why. Now, I come at it just from a research perspective, right? I have no experience in hyperbaric. I'm not a hyperbaric, expert or anything like that, but I read the literature on it. And all of the studies that are poorly done, meaning that there's no control group, right? If I take a group of 100 PCS patients and I put them all into the hyperbaric chamber, they will improve. And the results of that study look great, right? Yes, everyone had an improvement in their symptoms and they started feeling good from a cognitive perspective, whatever. But that's not really a good way of doing it. You have to have some sort of control where you need a placebo, right? Like if we were going to test a drug, we wouldn't be able to just give everyone that drug because we know how powerful placebo is because everyone getting that drug is going to improve. And then we're like, hey, the drug is great. No, no, no. What we have to do is give half the people the drug and half the people a non-effective, let's call it just a sugar pill. But they think everyone thinks they're in the treatment group, and then you see what happens. And if both groups get better to the same degree, then it's placebo, right? Because everyone just thinks they're getting good stuff, and then that just improves people's, symptoms because placebo is a powerful thing. What you need to do is have a significant enough difference between the placebo and the actual therapeutic drug to say, oh, the drug has this much of an effect over placebo, meaning that the drug actually does what we need it to do. With hyperbaric, the studies that have been done that are poor quality, meaning no control, no placebo, they show benefit. But then when you have a placebo where it's like you put people in the hyperbaric, but you just give them what's called surface air, meaning there's no pressurization and they're just getting normal oxygen levels at, 21% atmospheric, which everyone else is breathing. Put them in the tube, same treatment protocol. Guess what? Both groups get better to the same degree. So the recommendation now from a number of consensus statements on this is that there is strong evidence to suggest that hyperbaric does not work for PCS. Right? So, but the people that are proponents of it, they will quote these other studies that, are poorly done trials that show that hyperbaric is effective. But when you look at the higher quality studies with a placebo and a control, they get better, yes, but to the same degree, meaning that there isn't that gap between placebo and hyperbaric. Now, one study, right? So let's say there's 5 or 6 of these more high quality studies. One study recently in the past 2 years has come out and actually had a really good control, and hyperbaric did do better than the control. So that's only one study. So I'm not saying that this is completely out.
Yes.
But right now we have 5 studies that are high quality that show no effect, and we have 1 study that's high quality that shows a positive effect. So maybe as more research emerges, I'll change my position on this. But right now, I just think that it's an expensive protocol, and so far the evidence doesn't really support it being any much more than a placebo, right? If people and the reason why clinicians may be recommending this is because they might have had a patient that had PCS that went and did this and they got better. So they're using that as their, try hyperbaric because this patient got better. But how do we know that patient wasn't under the same placebo that other people are, and they're actually just going in there with the positive idea that this will work, and then they do the treatment, and it's mostly the mental health and the anxiety that goes away that actually makes them better. Do you know what I mean?
It makes total sense. Yeah.
Yeah.
No, thank
So
you.
I mean, you're welcome to try it. It's going to cost you money, and maybe there's a positive benefit there, probably from a variety of different things. Like there's evidence for hyperbaric for a number of conditions. It wouldn't surprise me that there's something there for concussion, but so far the evidence doesn't really support it, and it just depends on where you want to put your money, where you want to put your time, where you want to put your effort.
There's mechanistically something that I think is to it, but I think that, as Dr. Cam pointed out, up to now the research has been kind of heavily biased. But just so you know, it's 40 treatments, and it's like, $150, $200 a pop.
Yeah, it's expensive.
For a treatment.
Every day for an hour for 40 days.
Right, and so there are some potential side effects. If that's some people with eye issues, if it's some people with ear pressure, not to mention the time. So all that that factors into the algorithm here in terms of the benefits of the treatment or not. That being said, if you have the money and you want to do it and you've exhausted everything else, I think there could be something to it mechanistically, and we need more high quality trials to prove that.
Yeah, and like my position on it, sorry to cut you off there, but like my position on it is we have all sorts of really good evidence that these things work. And then people want to go for this like hyperbaric, because it's almost like, well, this seems easy. I just lay there in a tube for an hour and then it cures everything. That's not really how it works. It's like the way to fix PCS is to actually put in the work and fix those systems. It takes work. It takes time. It's frustrating, but we know that it works. We have really good evidence for it. Over here, we have really good evidence that it doesn't work. And we have a few low quality studies that show that it does work. So if you're going to spend your time and effort, I would prefer to push people over here to things that work rather than have you waste a bunch of time and money doing something that maybe at best you get a placebo out of. And the research
which is why I haven't even tried it, because of everything that you're saying, both of you, Dr. Paul and Dr. Marshall. It's exactly why I haven't tried it, because it's expensive. I do have ear issues, etc. But I can't tell you the amount of people who keep coming, back to me saying it, and I'm like,
I hear it every day. Like, this is one of the most common questions that we get is about hyperbaric. And so I don't know, they must have done some great marketing.
Somehow,
you have something that has a lot of evidence against it for this particular condition. And yet it's still like one of these things that all these people are touting. So, I mean, maybe there's something there that just we can't study well. I don't know.
I think there's also a novelty effect where sometimes the treatment that is the most kind of expensive, also kind of invasive, there seems to be a perception of that it's got to be better. There also is this kind of cachet around, like, athletes using it to recover, and oxygen's really good for you, so this means pressurized oxygen should be even better. There's like a lot of different factors. There are some clinics that just like they've created a whole business model about just doing this, not necessarily doing good concussion and PCS recovery care, and this ends up being one of the biggest factors. To me, it's like, do the CFIX, see the providers, and if anything's left, then and you have the cash, then
go experimental.
Yeah, go look at that.
And is there a last question? Is there a way then to flag? Because I know I've seen on your website there are certain providers that are trained by you to diagnostics, et cetera, but none of them. I'm in Austin, Texas currently. Speaking of Texas, and there's just not many or any people that I've seen that are actually trained by you all. Do you recommend flying up to see someone for a week or so?
No, because it doesn't work like that, unfortunately. So there's clinics all over the US, right? That'll charge you, again, getting back to the cachet of like, well, if it's expensive, it must be good. You have these clinics throughout the US. I won't name any names, but they'll charge you, 10 to 15 grand for a week intensive, right? And it just doesn't work. Concussion doesn't work like that. You're not going to recover in a week, right? And so the reason why I don't recommend people like flying to our clinics to see somebody is because the treatment protocol they're going to follow is going to take weeks and weeks and weeks. And unless you're planning on flying there every week to see them, right, it's going to be a complete waste to go for 1 week. Like if people want to come see me, for example, like I've had people fly over from Germany that want to see me. I'll tell them, like, you better plan on being here for 3 to 6 months, right? And if you're willing to do that, then maybe we can talk, because seeing me once, twice isn't going to do anything for you, because it's going to, we have to work on some of these things. It's going to take some time.
I mean, it could be a start though. Like sometimes people go somewhere and they get like really good assessment. And so in these cases where you don't have anyone locally, I definitely hear you when you're saying that. You might go and look for somebody that is maybe within driving distance. So you have to maybe drive 2 or 3 hours, or maybe go to the state beside you. And then you go back to your local provider with kind of an idea or plan, being like, hey, you have to do this. And I know that onus is a bit more on you, but I sometimes do this with providers or patients that don't have access to providers locally. We'll bring them in, just assess them, but don't expect you going somewhere is going to cure the concussion. I mean, there's clinics.
Oh, of course, yeah.
That like this is their jam. They do. So there needs to be that like continual treatment and follow up, and ideally you have somebody that you see regularly.
Yeah, I was talking more about the diagnostic, Dr. Paul. So exactly what you're saying. It's just getting more for the right diagnosis and then going back locally.
There's something to that, but I think there's a lot of bells and whistles in these big fancy clinics that might do it. And again, don't want to disparage that. Sometimes people find some benefits, but what often happens is that the basics, like the stuff we talk about in CFIX, just falls through the cracks, and patients don't actually get to those things because they're so focused on the gyrometer that they're in, or they're so focused on like the HPOT treatment that they did when they went to this retreat. It's if it's done the right way, it could be a good way of figuring out, all right, what's going on. But ultimately, you're gonna have to go back home and have somebody treat that for you and guide that process, right?
Right. Thank you all so much.
You're welcome.
I think a lot of people are really looking for this sense of like security in their providers, right? So if you don't have somebody close by, then it's sort of this sense of, oh, I feel kind of like on my own with it, right? And I know, number one in my clinical practice is people with chronic health issues and PCS. We need validation. We need to feel safe, right? So if we don't have that, sometimes that's what an assessment does for people, is just to say, I have this piece of paper that tells me what my plan is. I can feel safe with that. I can feel good about where to go. Then you can find your providers to sort of support you with that. But I think, one of the things we really aspire to do here is provide that community of support and ongoing, we're not going anywhere. We're here for you. That even just knowing that you have a community to lean on can, within a framework of treatment, can be really supportive.
Great. Do we want to do a few rapid fire questions from the chat?
Sure.
All right. Dr. Hrkal, can you share your opinion on soy milk? I can't do almond milk or other nut milks, and don't really use cow milk often, as I know it isn't the best to consume a lot of it. I like to make my own fancy tea instead of going to Starbucks. to try and cut down sugar. Would it be okay to use soy milk every afternoon for it? I know there's a mixed information about soy and hormones. I'm battling a bit of hormone imbalances as I'm starting perimenopause, but my tests weren't horrible.
Yeah, there's a lot of controversy about soy. I'm glad this question was asked. So soy milk, before the whole dairy alternative milk became so popular, soy milk was kind of the main milk that was available because there was a vegetarian option or vegan option that people were looking for. The big thing with soy, when you look at all the evidence in terms of its effect on hormones, a lot of it comes down to actually being positive in people over the long term. These are called longitudinal observational studies. There is a natural phytoestrogenic, phyto meaning plant, effect for some plants, and soy is the most well known, but there's many other plants that have this phytoestrogenic effect, like for example sage is one that comes to mind. And if you look at these same ingredients or herbs or foods in a petri dish, it does show that they interact with estrogen receptors in similar ways to estrogen. It is a lot weaker than our real hormones in our body. But then there is if I have a hormonally sensitive condition like fibroids or breast cancer, is that making it worse? And it's the fear around that from an oncology perspective that a lot of people have translated into the human data. But the human data overall shows it actually is protective against cancer, which might sound like a shock to a lot of people. Soy has a lot of beneficial ingredients and components in it. These active constituents do have some anti-inflammatory effects, but there are a couple of key caveats. So the short answer to your question is yes, I think soy is okay to consume in small amounts as long as it's organic, which means it should be non-GMO, because the genetically modified version, I think in this case, is going to be detrimental. And also any sort of exposure to environmental contaminants like glyphosate is higher in non-organic versions. So I think if you're looking for unsweetened organic soy milk as part of adding it to a latte, like a matcha latte or a tea or coffee even, I think that's totally fine. And again, have a conversation with your health provider. There are a couple situations, like in thyroid issues or in cancer issues, active cancer issues, then maybe that might not be the best idea. So obviously, always talk to your healthcare provider about that.
Great. Another one here. I have a question about the vision. I'm walking every day now. When I walk at the beach or in the dunes, things go quite okay. When I walk in the forest, I get headaches quickly and my eyes get tired really quick. I do make jokes about there's too many leaves, too many branches, but I want to know what is happening and what exercise of the vision module can I do to improve this?
It sounds like, it could be a visual motion thing, right? If there's just a lot of motion in your peripheral visual fields, sometimes people can have an issue with that. Sometimes that is neck related, so you can try getting some neck treatment and seeing if that improves. You can also just try to continue to expose yourself to that, right? So sometimes just gradual exposure to that which affects you can improve that and make it less. Those would be my two answers on that. There could also be issues with like over focalizing your vision. Like a lot of time people that have these motion sensitivities tend to be very like focalized in their vision, meaning that they're fixated on what they're actually looking at and they're not allowing their gaze to expand and kind of pick up the periphery. And usually in a wide open environment, it's kind of easier to do that. But when you're in, walking a trail or something in the woods, you do kind of over focalize because you're worried about tripping over things and whatever. So it could just be something like that. Like try opening up your gaze a little bit wider, and just like relaxing your gaze rather than being, hyper focalized on stuff. So those would be kind of the three main things that I can think of.
Great. Here's one. A friend was recovering from concussion and went for an MRI appointment. She had the scan, and then following the scan, she relapsed and never really got to back to baseline. Why would this be?
Best bet, anxiety response. You're in a confined tube it's loud, it's banging, there's noise going on. If you've ever been in an MRI, you're really squished in there. You don't have a lot of room to go. And that can be a high stress environment. Sometimes people are worried about what they might find. And so that can create a stress response. And so to me, there's nothing the MRI would do to affect your brain or anything like that, but it's your response to it, right? It's the same idea. Like somebody was asking about, craniosacral therapy that really flared up. It could be just the response to that, right? If you're feeling anxious and uncomfortable, and then you come out and you start thinking, oh, maybe this MRI did something to me. Well, now you start spiraling out of control on that. And then the stress of that just compounds and compounds. And now you're in this completely dysregulated state. So best bet is an anxiety response.
Okay. And maybe the last one here. I'm on the 6th day of taking CBD only. So this is actually from our live last week, where we had talked about CBD and things like that. So person's following up. I'm on the 6th day of taking CBD, only 25 milligrams at 8 a.m., trying to reduce my use of ibuprofen. I talked to you last week on the call. I felt nauseous and very tired. Thought I might be getting sick, slept 2 hours. On the 7th day, it was the same. Day 8, I cut my gummy in half with the same results. While writing this, I realized I must experiment more, maybe a break of a few days and start again with half. I guess my only question now is, wouldn't that nausea normally happen in the first few days and not the 6th? P.S. CBD has helped. I cut the use of my ibuprofen by 2/3.
The 6th day after starting something, it sometimes takes a kind of a building effect to happen. This happens with medications often enough. It also could be totally unrelated. It's not really clear just from the information that was put here. The fact that it's helping you, I think, is a good sign. And I think you're onto something by saying that you need to kind of experiment more to figure out, okay, does that still happen if you reduce the dose in half and continue it for a week? Does it still have the same effect if I use it every other day? So there's a number of other things I'd suggest before I would just pin it all on, the CBD piece.
Paul, what about the time of day? First thing in the morning can be a really sensitive time for a lot of people to take, a
Yeah,
supplement.
you could try it before bed, Melinda. That's a good point. That could be another way to offset that nausea. Some people do get nauseous. But again, also the symptom of nausea with CBD is not common in my experience. Usually people will take it for nausea. Now, mind you, there's a bit of a THC component to that too, which is helpful. So that's not really a common thing. And again, is this happening all the time? Or is this happening just doing it once and it happening on the 6th day? To me, is not enough to say this is causation.
What about the other ingredients in a gummy versus
Yeah, but if that was the case, that wouldn't have as much of an additive effect. That probably would have like an immediate effect if it was like some sort of preservative or some other non-medicinal ingredient. Usually people would have an immediate GI effect to that, or even like a non-GI effect. Like let's say a headache because you had polysorbate in it, for example. That's probably not high on my list, but a thought nevertheless.
Yeah, it sounds like it needs more time. A couple weeks.
Yeah.
Right? What if there was just a bug this week? It's winter. Well, here it's winter anyways.
There's a ton of norovirus going on right now. So
right?
It's huge.
Yeah, it could be coincidence.
And it's also presenting with really peculiar symptoms where it's like people get rashes and hives, and it's kind of like you feel this off and on nausea every couple days. My kids have kind of been going through it for the last month where they're good for 2 days and then they're like, Daddy, my stomach's hurting, it's off. And they're like, well, did you eat something? Did you overdo some junk food or, which they rarely ever eat. But, this is the presentation. And then they get some weird skin things. I've seen that. So maybe be a bit more patient there with it and curious about it, using Melinda's word.
Curious, perhaps, maybe. These are powerful.
We all have our little
powerful
mantras.
If anyone wants to know more, we did our The Power of Maybe live, right?
Yeah, that's a good point.
Great. I think that's a good spot to kind of wrap it up today, just looking at the time. All right. Have a fantastic Thursday, everyone. Bye.
Bye-bye. Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit, and don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.